Melissa McCarthy. I'm going to be performing the catheter insertion today, so my recorder is going to scan the room. And so the first thing I would do is I would make sure I verified the hospital policy for this procedure before entering the room. I would walk into the room, perform hand hygiene, introduce myself to the patient. I would get the order form and compare it to the wristbands. We have Jaguar Jones, birthday 8/25/1963, birthday 8/25/1963. Allergies are penicillin. Do you have any other allergies? No? So now I'm going to check the order. So we have insert/maintain indwelling urinary catheter and place on nurse-driven protocol to remove catheter when indications are no longer present. Indications for indwelling catheter per nurse-driven protocol are acute ventilator-dependent respiratory failure, acute worsening of mental status, and to assist in healing of open sacral or perineal wound in incontinent patients. So I can put this to the side. And so now I would gather all my equipment, which I have. I'm going to put on my goggles. And I already have my trash can positioned, but if I did have to position that, I would perform hand hygiene after I moved it. And I would raise the bed to a working height, lower the side rails. I would place the patient in a dorsal recumbent position with the legs slightly bent. And I would put on clean gloves, and I would provide perineal, I'd wash the perineal area. For a male, I would wash with a washcloth with soap and water. I would wash the thighs around the meatus, down the shaft, and then to the scrotum. For a female, I would have a washcloth with soap and water. I would clean the thighs, wash the labia majora and the labia minora. And so now I'm going to open my sterile kit. And so I want this pointing towards me so I can go away, open, and then towards me. And I'm being mindful of the 1-inch border. And now I'm going to put on my sterile gloves. And I forgot to mention that my bed is not above waist level, so in a hospital setting I would want it above waist level. So I would be contaminating while I reach over the sterile field. And putting on sterile gloves, I would want it above waist level. And so now that I have my sterile gloves on, I'm going to place my sterile field. So now that I've placed my sterile field, I am going to move the tray, and I'm going to prep the tray. So I'm going to open my betadine swabs and place them here. And I'm going to throw away, making sure to drop. And then I'm going to take my lubricant, I would put it right here. And then I'm going to remove my cap, place that back. And so now that I did that, I will attach this to the balloon port. And then I'm going to remove this, making sure that this does not fly around. I'm going to place it in the lubricant. And so for a female, you want to lubricate 1 to 2 inches, and for a male, you want to lubricate 5 to 7 inches. And so now I'm going to clean the urethra with the betadine. So with my non-dominant hand, which will now be contaminated, I would open this up, and then I would take one, do the outside, take another one, do the side closest to me, and then do it right down the middle. And then throughout after I cleaned it, I want to keep this open because if it does close, I would have to restart the procedure. And so now that this is lubricated, I'm going to pick it up and I want to insert until there is urine return. And then after urine return, for a female, I would insert 1 to 2 more inches, and for a male, I would insert until bifurcation. And so now I'm going to hold this. I'm going to inflate the balloon. And then I'm going to remove the syringe from here. And then I do need to use this syringe later. Normally we would use a different syringe, so I'm just going to put this on the side table. And so after I remove this syringe, I would tug on the catheter to check placement, and after I tugged on it, I would advance it slightly to take the pressure off the bladder neck. And so now I'm going to prep my stat lock device, which I have here. So the stat lock device, you want to put it on the inside thigh, and you use it to avoid trauma on the urethra. And so I would place it right here, and I would prep the skin before, so I can put that. And so how you clip it is you do it right at this area, and then you would just push the clip it, and then you would stick it to the thigh. And then now I'm going to take this, and I would normally put on a bed frame. I do not have anywhere to hook it on my bed frame, so I have this little setup to hook it on. And when in a hospital setting, you never want to hook it on the side rail. You always want it on the bed frame. And then I would make sure there was no dependent loops, no kinks or anything in here, which there are not. So I'm going to remove my gloves, and then I'm going to demonstrate a sterile specimen collection. So I'm going to remove my sterile gloves. I would perform hand hygiene, and then I'm going to put on my clean gloves. And so there are two ways you can do a specimen collection. One is straight from the port and one is from the bag. So I'm going to do the bag one first. I'm going to take that. So I have a towel placed, and I would have a graduated cylinder, but I used a cup for a graduated cylinder. And so you take this port, you want to remove this from there, and you want to ease it in the cup over the graduated cylinder. You never want to touch this to the cup. So once I have that, I will replace. I would cap, and I would label. And so then the second way to do it is, once again, I would have this cap off, and then I would have that there. I would take my syringe. This is why I needed to reuse this syringe. I would take an alcohol swab. I would clean this port. I would clean it with the alcohol swab. And then I would put this in the port, and I would pull back, urine return, and then I would, without touching the side of the cup, I would insert the urine, and then I would recap, and then I would label. So that's how you do the specimen collection. And so now I would lower the bed back down, raise the side rails back up. I would make sure the call light was in reach, and I'm going to remove my gloves. I would perform hand hygiene. And so for the documentation points of this procedure, you want to document the catheter size, the amount, color, and the consistency of the urine. You want to note how the patient tolerated the procedure, and if there was a specimen collection. And so after I insert the catheter, I would normally clean up all this, but I'm going to have to remove the catheter, so I'm going to keep that. And so after I insert a catheter, I would do daily catheter care with soap and water. And I would also provide daily catheter care with soap and water if there was any incontinence of stool. And then I would plan to remove the catheter when medically indicated. And so when I remove the catheter, I would make sure to review that order to make sure that order is there and that it was medically indicated. And I would drain this bag into the graduated cylinder so I could measure the amount of urine. And I would perform hand hygiene. I still already have my goggles on, and I'm going to put on clean gloves. So now that I have my clean gloves on, I'm going to take my syringe again, and you want to move it up and down just to loosen it up. And then you would put it back on this balloon port, and you would let gravity pull it down. And then once the balloon is deflated, which it is because it pulled back all of it, I will withdraw the catheter. After that, I would provide peritoneal care, and so I'm going to disconnect this. I would document the amount, color, odor, consistency of urine. I would document the intactness of the catheter tip. I would state how much water was removed from the balloon, so how much was pulled back with this syringe. I would document how the patient tolerated the procedure, the time I did this removal, and I would teach the patient about symptoms of a UTI. And I would come back in 4 to 6 hours to assess to see if he had voided. And if he did not void, I would palpate the bladder, and I would also perform a bladder scan. That completes my procedure.